Hello, my name is Talisa Ramirez. I'm in the BSN 225. I am doing the intradermal injection video. I have on my badge, correct scrubs. I have my supplies. So first I am going to look at the provider's order, state the 6 rights of medication, which are right medication, right patient, right time, right route, right documentation, right dose. Next, I'm going to look at verify the EHR. It is for tuberculin, 0.1 milliliters. I am going to calculate the dose if I had to. It's already done. So I will gather my supplies, go to my patient's room, knock on the door, provide patient privacy. I would also check to make sure my patient doesn't have any family members in the room. My patient doesn't. I would introduce myself. Hi, my name is Talisa. I'm going to be a nurse today. Can you tell me your name and date of birth? I would verify that on the armband. I would do my second medication check. Okay, so Ms. Smith, do you have any allergies, food, seasonal allergies, or medication allergies? No allergies. Okay, so the reason I'm here today is because your doctor ordered tuberculin, also known as a tuberculin. This is a test to check for the exposure to tuberculosis. It's also called a PPD test. Some of the side effects are bleeding and swelling, and some of the adverse effects are rash, shortness of breath, and fever. If you experience any of the adverse effects, please let me know. Do you have any questions? Okay, I do want to let you know that upon injection, you may feel a slight burning or stinging sensation, but that is normal. Any questions? Okay, so I'm going to perform hand hygiene. I'm going to apply my gloves. I am using the tuberculin 1 ml, 25 gauge, 5/8 needle. So I'm just going to take that out for right now. I am going to roll my medication. I'm going to wipe my medication. I'm going to drop the 0.1 mLs of air. .1 mLs. Going to inject the air. Invert the bottle. Drop the 1 ml. I do have some air. I'm going to get the air out of there. 1 ml. I'm going to recap the needle. No air. 0.1 ml. Okay. So now I'm going to check my site. So I'm going to pick the correct site, which is 3 to 4 fingers width in the antecubital and one hand above the wrist. So it'll be in the middle here. You want to assess your site, making sure there's no tenderness when you palpate, no lesions, no rash. Miss Smith, does this hurt? Okay. Okay, so you want to clean your site. You also want to check for make sure there's no skin discoloration. Okay, so we have cleaned the site. Okay, so now we're gonna get the syringe. You want to hold the skin taut. You want to have the bevel up. Hold the skin taut with the non-dominant hand. Hold the needle with the bevel up with the dominant hand. You're going to go 5 to 15 degree angle. You're going to go through the dermis 1/8 inch. And you're going to feel some resemblance. You're going to slowly inject the medication. You're going to take it out, put the needle into the sharps container. You're going to get alcohol wipe and place it over the site. You do not want to massage the site. You're just putting the alcohol pad there to just soak up any blood if there was any blood. My patient is not bleeding. My patient does not need a bandage. There is a 6 to 10 millimeter bleb. It kind of resembles a mosquito bite. So next, I am going to take off my gloves, perform hand hygiene, and document.